Dr. Hoffman, really appreciate you joining me today for this. As I mentioned to you before I started recording, this is something we're really excited to do, to share with our community here about what experts in the field of health, wellness, fitness have to offer and how they can help some folks. And so for those who don't know, Dr. Eve Hoffman is a orthopedic spine surgeon at Summit Orthopedics here in the DC area. And I had the pleasure of meeting her a few weeks ago and wanted to get a chance to just find out a little more myself, and then hopefully share it with anybody out here who's listening, so that they can learn a little bit more about how Dr. Hoffman helps everybody here in the community. So appreciate you joining us.
Thanks for having me. Looking forward to it.
Awesome. So Dr. Hoffman, first and foremost, what got you started in medicine in the first place?
So my initial appeal towards medicine actually was sort of from the engineering side of it. Going through middle school and high school, I actually thought that I wanted to be a biomedical engineer. And the reason I thought that was that my dad growing up did some consulting work for different medical device companies. He worked for companies that were having their patents infringed upon. And so he actually brought home some really cool medical devices when I was growing up. I remember especially being really interested in looking at cardiac stents that he was doing a case on. And that just really piqued my interest in medicine. So that's how it started.
Wow, that's awesome. That's a super cool story. And now I also read on your bio that at age 17, you joined the Bethesda Chevy Chase rescue squad as an emergency medical technician. So I don't know about a lot of other people, but at age 17, I definitely was not doing that. So I'd love to hear more about just about how that experience was at such a young age. It must have been awesome.
Yeah, it was one of the coolest things I've done, I would say. So because I had an idea that I wanted to be involved in medicine at that young age, I was really looking for an opportunity to get involved, sort of see what medicine was all about. And I had a friend growing up whose older brother actually was an emergency medical technician. So I got a little bit more information. I realized that I could sign up for the class as soon as I turned 16. So I had planned a couple years in advance to know that I was going to spend the summer I turned 16 taking the EMT class, and it was it's a volunteer. Everyone at Bethesda Chevy Chase Rescue Squad is all volunteers at nighttime and on the weekends. So I just found out a little bit more information about that, joined the class as soon as I could, as soon as I turned 16. And so that was how I spent my summer that summer. And then from there on, I started out sort of in the back of the ambulance with someone more senior, and then over the course of the next couple of years, passed all the tests to become the EMT in charge on the ambulance, which was nerve-wracking but really exciting, and definitely one of the coolest things a 16-year-old that knows they want to go into medicine can do. So that's how that happened.
That's awesome. I really appreciate you sharing that. That's super cool.
Yeah.
So now fast forward to today, what got you into, because obviously there's a lot of different routes somebody in medicine can decide to go to. So what got you going into the specialty you have now of specializing in like orthopedic spine surgery?
So again, it sort of goes back to that idea that I was really interested in devices. And so I realized, at some point during college, I thought, I don't really want to be an engineer so much. I really like the patient interaction part of it, but I am still really interested in like fancy tools, the use of different fun devices. And so that's how I sort of got drawn into orthopedics. When I was in college, I actually worked for an orthopedic testing lab. And that was also like another summer job I had, just found something that looked interesting to me. And so what that lab did is they did a lot of the testing for new devices. So anytime a company was coming up with something that they wanted to get FDA approval for, they would come to that lab. They would bring physicians in to sort of test out their stuff, tell them what they thought. thought that was really awesome. And then the other part of that lab actually helped to do a lot of the biomechanical testing that the orthopedic residents were doing at that time. So that's how I got sort of linked up with seeing what an orthopedic surgeon does, and I loved it. So that's how I chose orthopedics.
Wow, that's such a cool story, and it's kind of cool to see how that sort of evolved and got you to specializing in obviously what you specialize in today. Now, you and I have been talking about some of the recent or newer advances in spine surgery, and I know there's all sorts of just really cool and the things that are happening out there, but I hear of these things, but I definitely am not an expert in this stuff. So what can you tell us about just some of the things that people might hear about? I know you mentioned like the robotics are involved and also all sorts of other things. I'd love to just hear what's going on that you've seen and you probably utilize yourself.
Yeah, so I think the big thing that a lot of people are reading about these days is robotics in surgery, and that's something that has been used for a longer time in urology, but is now sort of making an appearance in orthopedics. And so I had the sort of privilege of being able to be trained during part of my training on one of the newer robots that's designed specifically for spine surgery. And I thought that was a really great experience. I think it's sort of still in its infancy. So a lot of the things that the robot can do is assist me in placing pedicle screws, which is how I do spine fusions for the lumbar spine. So I'm able to use imaging, preoperative imaging, to sort of guide where I would like the screws to be placed. And then the robot sort of helps me guide those screws into the exact correct position. I would say right now, again, it's sort of still in its infancy. And I think for certain cases, it can be quite helpful. But for the majority of the surgeries that I'm performing, it is definitely not something I need or rely on. But I think over the course of my career, I look forward to seeing how that technology is going to advance and incorporating that as necessary into my practice.
Yeah, and I appreciate you mentioning that. So it sounds almost like a lot of these like things involving robotics are there, like you mentioned, they're still in their infancy, they're still new. So it's almost like we're going to look for them probably to continue to evolve as time goes on. But because you've, been in there sort of from the ground floor, so to speak, now you get a chance to kind of see the growth of it and how it can just be beneficial to clinical practice as it becomes more of a proven sort of thing and it evolves.
Yeah, I think the important thing to know about robotics, especially in spine surgery, is it's definitely past the stage where we know it's safe. So anytime it's being used, it's definitely safe, and it's not doing my job for me. It's sort of working with me. So I am watching to make sure that the location that it is moving in is safe, and the actual putting in of the instrument, I'm still doing it sort of as an assistant at this point. And so that's something obviously patients would be interested to know, that it is definitely proven to be safe. And so we're sort of going, the idea is in the next several years, we'll go sort of beyond the assistant stage to what more can this help me with.
Awesome. Yeah, I know, because that sounds fantastic. Because obviously, I'm sure with any surgery, the more tools you can have to help you be as safe as possible and make them be as successful as possible, the better. And so that sounds really exciting. It's just like another thing that can be utilized to just enhance all that.
That's true. Yeah.
That's awesome. So now, if I'm somebody listening to this, and let's say I'm dealing with a neck issue, or maybe a mid-back issue, or a lower back issue for that matter, how do I know whether or not I should reach out to somebody such as yourself?
So I think that's a really good question, and especially a great question because back pain, neck pain is so common. We know sort of over the course of a lifetime, 80 to 90% of people will experience some amount of neck pain or back pain. The great news is, for the most part, that really goes away with a little bit of time and maybe some medicine to help you through that period of time. So the people that I encourage, first of all, I'm happy to see anyone, even if they've had one day of back pain. I'm happy to see them and just talk a little bit about what I think is going on. Just it really does help people to just be reassured in terms of that. But I think the sort of things that patients should be thinking about when they say, when should I see an orthopedic surgeon, is if they've had back or neck pain that has been worsening or going on for a month or longer without getting any better. That's when they should start thinking about seeing a doctor, and specifically an orthopedic surgeon. And then I think the other big things would be if they experience any issues with pain that shoots down the arms or the legs. That would be a sign that there may be a pinched nerve somewhere. And that, again, is not an emergency, but something that is frequently patients that I see in my office, and I'm always happy to sort of discuss what I think may be going on and ways to make patients feel better with those types of symptoms.
Got it. I appreciate you sharing that. That's, I'm sure, gives me a lot of clarity myself, because I'm sure anybody who has worked with us as physical therapists, I mean, they know a lot of times we do need to be able to refer out, and that's always helpful to know, so that we can relay that as well. So I appreciate you sharing that for my selfish reasons. And so if a patient comes in to see you, does that automatically mean that they're going to have surgery recommended to them?
Definitely not. I would say of the patients I see in a day, 90% of them don't need surgery now, potentially don't need surgery ever. I think that it is, especially a lot of the things that I see are sort of more degenerative processes that someone may be experiencing symptoms for the first time, but this is something that's been ongoing for a long time. And so the first thing is, I think it is reasonable to establish a relationship with the doctor that can sort of monitor these symptoms over time. For the most part, as I mentioned, back pain and neck pain does go away with non-operative measures, which is generally always starting with some amount of activity modification, talking about medical management and non-narcotic medical management. And then a little bit of physical therapy is always a great thing. And really, I think for most patients that see me, getting into physical therapy is important in the early stages. And then it's only after those things have failed to relieve symptoms that I would talk about anything further. And in spine surgery, I'm lucky because there's a step before we get to surgery, which usually involves a trial of different epidural injections, which is a steroid that we can inject into different parts of the spine that we think may be causing symptoms. And that it really does two things. It helps me with the diagnosis because we can target a different part of the spine to really make sure that that is the part of the spine that is causing the symptoms. And then on the other hand, it also can help alleviate symptoms for hopefully forever, but oftentimes for a long time. And so that, again, is a way that we can manage symptoms without surgery.
Wow, that's awesome. So it sounds like there's, so for anybody who comes in, it almost sounds like a lot of the value can be just getting some clarity as to, hey, what is actually happening? Like, why am I experiencing what I'm experiencing? And then figuring out just what do I need to do about it? Do I need to just, modify my activities? Do I need to go to rehab? Do I need to maybe try some sort of conservative method, such as an injection or something like that? But there's a lot of avenues they can go down prior to surgery. So people don't automatically think, oh, I'm going to see a surgeon, that means I'm getting surgery.
No. Yeah, I think that's definitely important for people to realize. And I love seeing patients back that have gotten better with the other stuff. That makes my day certainly easier than having to do a big operation. And, they're happy to. So.
Sure. No, that's fantastic to hear. And now, Dr. Hoffman, you definitely answered all my questions. So I really appreciate that. For anybody else listening, is there anything else that we didn't touch on that you would like to add?
I again would just reiterate that I'm always happy to see patients no matter what length of time they've had symptoms. I think you mentioned or touched on this, but it really can be quite comforting just to have a diagnosis. And the spine is a complicated thing. And again, there's a lot of different parts of the spine that can be causing symptoms. So just sort of figuring that out is a team effort. And I'm always happy to sort of figure that out with patients. So
And
thank
I
you so much
appreciate
for doing it.
that. I appreciate that. And I know for a lot of the folks that we work with, the back pain is one of those very back pain and neck pain and anything originating from the spine does tend to be a big source of frustration, because I know how based on how the symptoms change and move and do all these things, it can almost seem unclear. And you're right, getting that diagnosis is just so helpful. So I appreciate that. And for anybody who, again, wants to find Dr. Hoffman, she's at Summit Orthopedics here in the DC area. And as I mentioned before, their website is Summit, SUMMIT-orthopedics.com. And Dr. Hoffman has her own personal website, which is EveEveHoffman.com. So, of course, she has offices here in DC and and then am I right, in Bethesda, Chevy Chase area as well.
Exactly. Yep, we're on Wisconsin Avenue, and then I have an office near American University as well. So, yeah.
Awesome. Well, Dr. Hoffman, I really appreciate this. This was so informative for me, and I know a lot of other people out there benefit as well. So thank you so much for your time.
Thank you very much. This is great.